I didn't think it would be bowel cancer for me. I thought it would either be diverticulitis or Crohn's disease or something like that. So I wasn't aware that people of my age could be diagnosed with bowel cancer. On the 23rd week of my pregnancy, I had a big pain in the side, the left side of my stomach, and I went to the doctor in the middle of the night because it was a stabbing pain. And I went along and he had a feel around and he diagnosed round ligament pain. So he told me to go home, rest, and then see how I am in the morning. In the morning, I still had a bit of pain, but it reduced, so I just left it there. After that, I carried on and I actually was rushed into hospital at 27 weeks pregnant because the baby had stopped moving. So went in, had an emergency C-section, and she'd stopped growing at 23 weeks, which was exactly the time that I had this pain in my side.
Hayley's daughter survived for 4 weeks in neonatal intensive care, but unfortunately she had a blood clot in her small bowel and she passed away. 2 weeks after her baby was born, Hayley had the pain in her abdomen again, which this time was diagnosed as an infection.
So they gave me antibiotics and then the pain went away again. So that continued, but I also had a palpable lump. So they just thought it'd go down after the antibiotics. And I didn't have any problems until sort of mid-December of that year. So this all happened in July. December, I again had this pain come back. I could actually feel the lump in my side, and I started to get more symptoms like sickness, diarrhoea, and feeling extremely tired.
After another visit to her GP, Hayley was sent to the surgical assessment unit at her local hospital.
I had an ultrasound scan. They couldn't see. They saw a bit of thickening of the bowel lining. So a CT scan came, and then they discovered that it was actually a tumour that was in my bowel. So 4 days later, I was in the theatre. The surgeon sort of gave me the facts about it, but there wasn't really any support just after being given such a shocking diagnosis. We'd gone from losing our daughter to 3 months later a cancer diagnosis, and there wasn't really any time to grieve for her, as well as all of a sudden having this awful news as well about cancer. So I think the support I got was mainly from family who were also going through the tough time of it as well. It was a really difficult time. The surgeon had said most definitely that the tumour was part of the reason that our daughter came 13 weeks prematurely, and that was really difficult because I'd finally got an answer as to why she'd come so early and passed away, but I also felt awful that my body had let me down in such a terrible way. Once I was diagnosed, I was told the next day I would need an operation. This was 4 days before Christmas. So they said that, we need this to come out of you. So I went into theatre, I think it was about 9 o'clock in the morning, and 7.5 hours later, after keyhole surgery, the tumour was removed, and I went into a high dependency unit where I remained for a few days until Christmas Day and was moved into a ward. So it was quite a miserable Christmas.
Hayley and her husband were warned that the chemotherapy and radiotherapy that would follow her operation could affect her fertility.
I was referred on to the oncologist to then get referred on for fertility treatment, which ideally I needed within sort of 6 to 12 weeks of the operation, because obviously chemotherapy, they like to be given to you within 3 months after your operation. So we went on and researched about IVF.
Before the start of her chemotherapy, Hayley was able to have eggs harvested and stored, so that she has the option of IVF treatment or a surrogate at a later date.
That was the immediate sort of thing that we needed to do after the operation and before treatment started. So that was very important to us. I have to say that it was just after my operation, and once I started to feel a little bit better whilst I was still in hospital, I was researching on Twitter, trying to find other people in similar situations to me, and I did start to come across people of a similar age, and started connecting with them and talking about our experiences and what would happen with treatment, and so I would know what to expect.
After the operation to remove the tumour, Hayley had 6 sessions of chemotherapy, followed by 25 sessions of radiotherapy, followed by another 6 sessions of chemotherapy.
The chemotherapy was very harsh on my body. I was allergic to one of the chemotherapies. I did continue taking it, but I had to have a lot of drugs to offset that allergic reaction that I had. So it was very tough on my body, but I managed to get through all 12 rounds safely and finished the treatment in October of last year. I had a scan at 6 weeks after the treatment had finished and had to wait a month for the results. So that was quite challenging in itself, you know, having that wait to see whether it worked and whether I was still cancer-free. And happily, after that, in October last year, I was given the all clear. So it's a case of having to go back every 6 months for 2 years for check-up scans just to make sure that I'm still all clear. And then another 3 years after that, it'll be once a year. So I'm just hoping that it stays that way.
Although Hayley has been given the all clear, she still has contact with a colorectal nurse and feels that she still needs support as she gets back to normal life.
I do feel that I still need that support, even though I'm starting to get on with my life a little bit more. I think it takes a lot to sort of digest that information that you've had cancer and you're still considered a patient. So I do continue to seek that information from those sources. I went back to work in January this year, started back part-time, just to get myself back into the swing of things, getting back into a more normal way of life after such a disruptive and it was a trying year and a half. It does feel really nice to get back into work, and in all honesty, it's a good distraction. You know, I don't have to think so much about what's happened and the cancer diagnosis. It's nice to get back into doing things that seem normal to me now.